Well, it's time for our health report. Joining us now is Africa 54 health correspondent Lino Mudu with more news on the deadly Ebola virus. Hello, Lino.
Hello, Vincent. Hello, everyone. The Ebola crisis in West Africa is taking a horrible toll on medical personnel. A lack of resources and trained medical professionals are making the fight against the disease much more difficult. In Sierra Leone, healthcare workers are understaffed and overworked. To date, 4 Sierra Leonean doctors have died. In Freetown, Connaught Hospital is swamped with suspected cases of Ebola. It has an isolation unit with both international and local staffers volunteering their time to treat Ebola patients. 21-year-old Sewa Mansare is a medical student and a volunteer who wants to help his country and learn from professionals.
I only decided to do so because maybe I know to save my people is my priority. I joined the medical side just because to save my people, and if I see my people dying like that, I need to come. Even though I don't have much experience in it, it is good to come on board. And the other thing is to gain more idea from the doctors that I meet.
About 300 healthcare workers have become infected since the Ebola outbreak was first begun in March. The World Health Organization Assistant Director General Bruce Aylward says the Ebola crisis requires a much faster escalation of the response in order to be contained.
Ladies and gentlemen, this health crisis we face is unparalleled in modern times. The gravity of the situation is difficult to get across with just a few numbers, but with 5,000 now infected, twice the number when we met a couple of weeks ago, over 2,500 dead, nearly twice the number of when we met a couple of weeks ago, you start to get a sense of the rapid escalation now we're seeing of the virus as it moves from what was a linear increase in cases to now almost an exponential increase in cases. What began as an Ebola outbreak in these countries 6 months ago, or in one of these countries, and then became an Ebola crisis, has now become a health sector crisis and a larger crises of essential services in these countries and social services.
For people with impaired mobility, the world is one long obstacle course. Even the simplest of tasks can be challenging, such as boarding a bus, reaching for a can on a pantry shelf, or using a restroom unaided can be beyond the capabilities of people with birth defects or spinal cord injuries. But as Mike Osborne reports, a research program in Tennessee shows that even relatively minor improvements in mobility can make a huge difference in the lives of people with disabilities.
Tim Patterson is going for a walk. Quite remarkable, since a tumor on his spine 7 years ago left him in a wheelchair. So just standing up is a major accomplishment. Patterson is participating in mobility research using water treadmills.
I had no movement in my feet whatsoever before I started the program, and now I'm up on a walker walking maybe 90 feet before I have to sit down, you know. So it's drastic.
The key is water, says Sandy Stevens, who's leading the research at Middle Tennessee State University's Human Performance Lab. She says therapy in water is ideal because there's less chance of injury from a fall, and water makes the legs lighter and easier to move.
With very minimal control, with very limited muscle strength, they can take a step forward. And once you build that pattern, then you have something to work with.
That's because walking is partially a reflex action. Even when a spinal cord injury severs the connection to the brain, the legs remember how to take a step.
The stimulus for walking is weight bearing in an upright position. And if we can provide an environment that allows that, then a natural step will occur even if the brain can't stimulate it.
The research so far suggests water therapy can provide small but significant improvement in walking ability. And Stevens notes even those modest changes can have a dramatic impact.
Somebody doesn't have to walk 100 yards to have it be a meaningful change. You know, that if you can walk far enough to get through a bathroom door if it's too narrow for your wheelchair, then all of a sudden a lot of options open up for you in the community.
It's taken 2 years of intense therapy, but those options are starting to open up for Tim Patterson. Lab Director Don Morgan says the next step is to explore why the water treadmill helps improve mobility.
For example, are certain areas of the brain turning on where they didn't turn on before? There's certain sections of the spinal cord now that have been re-innervated as a result of what's going on in the periphery. In other words, what's going on at the legs.
Morgan says regardless where this research might lead, it has at least given people with disabilities hope for the future and the chance to begin a new, normal life. For VOA News, I'm Mike Osborne in Murfreesboro, Tennessee.
And that's our Africa 54 Health Report for today. Back to you, Vincent.